There are so many myths about hospice and the care that hospice provides, and my next guest, Edie Rimas, is here to really clear up those myths. Edie, I'm so glad you could come in and talk about Compassus, which is the hospice organization that Edie is affiliated with.
That is correct.
You know, we think of hospice as, okay, it's an end-of-life option, it's at the end of someone's life, and that really is not the way we should be embracing hospice, is it?
No, it isn't at all. Hospice is really about when you can no longer seek that curative treatment, but you really want to focus on comfort, and you really want to focus on the last phase of life, the last journey you want to do.
I love that word you used before we started, yes.
Yeah,
okay.
It really is an end-of-life journey, and everybody needs to kind of choose how they want to do that. Some people want to really focus on spending time with family, maybe taking a trip, maybe doing things that they had always had on their bucket list, and so that's a great way to look at it, and that's one of the things that hospice really helps people do, is be comfortable during that last phase of life.
I think another misconception a lot of people have is that it's only for people with cancer diagnoses, and that is not
Absolutely
it at all.
Not correct. No, we care for many patients that have cardiac disease, end-stage cardiac, end-stage pulmonary disease, patients that have neuro diseases. Maybe they've got an Alzheimer's or a dementia that has very progressed. And so Parkinson's disease, could be liver failure, could be renal failure. All of those are diseases that people face with different degrees of time frame before their life concludes. And so how do we help them with that journey? What do they want to accomplish?
What is the time, the ideal time, if there is such a time, the appropriate time to bring hospice in to a patient's, a family's life?
Well, what Medicare says is that a patient should have 6 months or less to live. But what's interesting is what we find is that patients who enter hospice typically live longer. Mm-hmm. And it's because there's support in the home. There's a multidisciplinary team caring for them, the nurse, the social worker, the chaplain, the bereavement, the home health aide, and all of that team can come to the home and care for them. And the home can be anywhere. It doesn't matter where the home is, but we'll care for them there. And so therefore, it's just a matter of making sure that they get the right level of care for what they're needing.
Mm-hmm. I know that there are some hospice beds in some hospitals where they have a section dedicated to hospice. So why would someone need to go into the hospital, though?
Maybe we couldn't get their pain under control or their symptom under control. Sometimes as the body shuts down, dependent on what the disease is, mm-hmm. it can be difficult. So pain might be an issue, nausea and vomiting might be the issue. It could be that they're agitated. Sometimes we find, especially patients who have had World War II veterans, the shutting down of the brain after they've gone through a war can be very different than the way you or I might shut down our body. Mm-hmm. And so sometimes you need the hospital to help manage those symptoms.
Okay, let's switch gears just for a second and talk about payment. Who pays for hospice? How is that managed and taken care of?
Medicare pays for hospice, Medicaid pays for hospice, and 90 or 100% of all insurances will pay for hospice. Almost every insurance provider will cover a hospice benefit.
With that many organizations covering hospice and insurance, why don't more people take advantage of it when it's so available as well? Like I don't know if I said this earlier, with Compassus, which is one of multiple hospice organizations.
Correct.
So why don't more people take advantage of this?
It's fear. It's afraid of dying. It's people don't want to hear the word dying.
They think it's giving up, too.
They do.
Some people, don't they?
They do. And oftentimes what we really want to focus on is what are their goals? What are their goals of care at the end of life? And then how do we make sure that we have helped them achieve them? Mm-hmm. And get them the support that they need in order to kind of maybe do the things they want to do. Mm-hmm. Maybe it's a wedding they want to attend. Maybe it's a graduation. We want them to be able to do those things. And getting symptoms under control means that they can.
Mm-hmm. This involves the entire family too.
It does.
I would think the whole family needs to be on board.
Yep.
And you're addressing, hospice is addressing the entire family, I would think.
We are. And underneath hospice, we provide support with social worker and the chaplain as the patient and the family are going through the illness. But then we also provide support for 13 months to the family after the death of the loved one. And that could be something as individual grief counseling. It could be a grief support group. And it's all free of charge to the patient's family, so that they can receive support dealing with loss after the individual has passed.
It's an incredible service.
It is.
It really, really is. If someone watching today thinks this could somehow help a loved one through this end-of-life journey and the entire family structure, where can they go for help? How do they find Compassus? How do they find you?
So individuals can go primarily to their primary care physician or their treating physician and ask for information about hospice. Compassus, as well as other local hospice organizations, are all easily found. Compassus has the website where you're welcome to go there and you can look up any location. We have 3 locations in Tennessee for Compassus, but there are many organizations, hospice agencies within the community that are there to help.
You know, God bless the people that work for hospice too, because I know from doing a documentary years ago with a patient, her end-of-life journey, it was really a beautiful thing to watch at that stage of her life and how hospice helped. So thank you for all you do, Edie.
Thank you.
Thanks for coming in and talking about it.
I appreciate it. Thank you so much.
And we'll be right back with a lot more after this.